Gus at 7:49 right now, and today in the Box 6 Health Center, if you're having sinus problems, there could be a procedure that could help. Dr. Kandula is here from Wheaton Franciscan Healthcare, and Michelle Phillips, who's had this surgery. Thank you both so much for being here this morning.
Thank you.
No problem. Sinuplasty is what it's called, right?
Yep, absolutely.
And this is, you were saying, just like an angioplasty, a little tiny balloon.
It's an angioplasty balloon that we put in through the nose, up into the natural sinus openings, and we inflate it. And what it does is it expands the bony openings into the sinuses, which lets all the junk come out, basically.
Yeah, and these are people, and millions of Americans suffer from this, correct?
Yeah, it's actually one of the most common reasons for people to visit the doctor.
Right. And that's what you did. You've had sinus problems for a long time before you went and looked into this, right? Tell me your story a little bit.
Well, before I had the surgery, I was on antibiotics for approximately 3 months every year. I mean, it was just 3 months solid, and just miserable all the time. Headaches, I couldn't function, it was hard for me to work. And the first doctor that I went to actually just wanted to drill everything out, and I just know that there's a lot of side effects to it. And so when I heard about this procedure, I tried that out, and it has made a night and day difference in my life.
You said it's just huge, and you got this when? Back in December?
I had it back in December, and since I haven't had any problems at all, so you could say it's a success story.
Now, doctor, these are the majority of people who come to you, the ones that, because traditional sinus surgery, we were just talking during the break, it's not pretty, right?
Yeah, although that's improved somewhat, so I don't want to scare anybody away from what needs to be done if that needs to be done. But this is a nice option for people who aren't real interested in very aggressive surgeries and things like that, but are still miserable, and so it just hits that nice middle road where we can do something that's going to help the cause. It's not just another antibiotic.
Okay, and now these are things, and you were saying a little bit earlier, these little tiny balloons, and they're inserted on either side of your nose, right?
Exactly.
Just right here.
Yeah, so they go in through the nose. We're looking in with a little camera on a video screen. The balloon goes into the sinus opening. We expand it, deflate it. It usually takes about 5 or 10 seconds to actually just inflate it and deflate it, and that's it. Nothing's left in, and the opening stays open.
And one of the biggest issues is recovery, right? How is that long? Is that difficult?
Everybody's different, and sometimes I'm doing that procedure in combination with other things, so it kind of depends on what you end up going through, or all the things that you need to have happen. But most of the time it's pretty low key. It's usually not a lot of pain. It's usually just the annoyance of having kind of a stuffy nose.
Right, and that's what you were going through, right? Now you wouldn't say pain per se, but it was just chronic and constant. And
it was pain. I mean, it was horrible up until that point.
Okay.
But I mean, back to the recovery time. I mean, after 5 days of just recovery, I was fine. It was just a little bit of a stuffy nose for a few months after that, and
fascinating. So who's a good candidate for this?
Really, anybody who has to think about their nose or sinuses often, which there's a lot of people out there who have been frustrated with recurrent antibiotics and just not really getting better, but just sort of getting by. They're great candidates. There's a lot of people who have sinus pressure kind of headaches with weather changes and things like that. They're also great candidates that before this we really didn't have any good options for them at all.
Right, and you were saying that there are some people who would have to go on even if this did not work, right, to traditional surgery.
It doesn't burn any bridges, and the risks are minimal compared to the traditional surgery, so it's a really nice fit for a lot of people.
All right, very interesting. Well, thanks for being here this morning.
Thank you.
I'm glad to hear it's working for you. Thanks for being here as well. Wheaton Franciscan Healthcare System for more information on the procedure. Thank you guys for being here. Stay with us. We'll be back after this.